Hello and welcome to This Month in Optometry Science. Studies for this episode were picked by Beth Higgins, who I recently spoke with about her own paper looking into a way to test patients with AMD in a way that is closer to real-world vision than a standard test chart. If you haven't watched it already, I highly recommend giving it a go after this. A prospective evaluation of the clinical safety and effectiveness of a COVID-19 urgent eye care service across 5 areas in England. The aim of this study was to quantify the clinical safety and effectiveness of a COVID-19 urgent eye care service, otherwise known as CUES, in Luton, Bedford, Hull, East Riding of Yorkshire and Harrogate. The study includes 1,100 patients who had nearly 1,200 appointments. Patients with acute ocular pathologies who had accessed the service were asked what the optometrist's recommendation was, whether this worked, if they had to present elsewhere, and how satisfied they were with the CUES service. 27% of patients managed virtually did not have their acute eye problem resolved. When we look at patients managed in person, this figure falls to 6.3%. Patients who attended a face-to-face consultation were 4.7 times more likely to be correctly managed compared to those managed virtually. 43% of patients referred directly from telephone consultations to hospital ophthalmology departments were false positive. In contrast, for patients who had received a face-to-face consultation, only 15% were false positive. It is worth noting that patients were overall very satisfied with the service that they received from the COVID-19 urgent eye care service. The authors concluded that this data indicates optometrist teleconsultations were not effective at resolving patients' acute onset eye problems. The number and range of pathologies missed by virtual consultations suggests that the service may be detrimental to patient safety. Reticular pseudodrusen, a clinical phenotype in age-related macular degeneration. This is a comprehensive review of reticular pseudodrusen, or RPDs, and their relationship with age-related macular degeneration. Multimodal imaging has revealed RPDs to have a subretinal location, but consensus is needed regarding their clinical definition and classification. The review proposes an OCT-based clinical imaging definition that the presence of more than 4 definitive lesions seen on 2 or more OCT-B scans is required, as well as confirmation of the lesion's presence on at least one on-FAS imaging modality that does not include colour fundus imaging, as this is suboptimal at detecting RPDs. There is higher prevalence of RPDs in people with late AMD, particularly type 3 neovascularization, compared to people with early stage AMD. There is also strong evidence that RPD presence indicates a greater risk of rate of atrophy in eyes with geographic atrophy, indicating their prognostic significance. The lead randomized trial has suggested that the effect of treatment in early stages of AMD could differ based on the presence of RPD. When evaluating AMD-associated genes, there appears to be evidence for a significant difference in the ARMS2 but not CFH variants in individuals with compared to without RPD when evaluating individuals with AMD. Further research needs to consider RPD presence in AMD in order to determine independent impacts of RPD presence. Furthermore, novel artificial intelligence techniques being developed could help provide an objective and automated method for identifying and quantifying the amount of RPD present in an eye. Such techniques will accelerate research to further understand the epidemiology and clinical associations of RPD. The impact of COVID-19 on missed ophthalmology clinic visits. The aim of this study was to measure the impact of the COVID-19 pandemic on missed ophthalmology clinic visits and the influence of patient and eye disease characteristics on the likelihood of missing clinic visits before and during the pandemic. A retrospective observational study analysing eye clinic patients at Byers Eye Institute at Stanford University School of Medicine, a large tertiary care academic institution in California. The study was looking at data of scheduled eye care pre-COVID-19 and when the pandemic started to affect the USA. Frequency of missed appointments were evaluated for each time period. In the assessed period before COVID-19 was a factor, 82% of patients completed all scheduled visits, compared to only 59% during early COVID-19. Missed visits increased dramatically in late March 2020 and then improved week by week through the end of May 2020. General ophthalmology, cataract and strabismus clinics had the highest rate of missed clinical visits, while neuro-ophthalmology, retina, cornea, ocular plastics and glaucoma had the lowest. Females, blacks, Hispanics, Asians, ages 50 plus and married patients had higher odds of missing clinic visits both pre-COVID-19 and during COVID-19. Asian, elderly and cataract patients had higher odds of missing clinic visits during COVID-19. Patients who are not married or suffered from diabetic macular edema and wet age-related macular degeneration had the lowest odds of missing visits during COVID-19. Primary trabeculectomy versus primary glaucoma eye drops for newly diagnosed advanced glaucoma. This randomized control trial aimed to compare primary medical management with surgical treatment in patients with primary open-angle glaucoma presenting with advanced disease in terms of health-related quality of life, clinical effectiveness, safety, and cost-effectiveness. The study was conducted at secondary eye care services in adult participants presenting with primary open-angle glaucoma in at least one eye. The primary outcomes was health-related quality of life questionnaire called the Visual Function 25, measured at 2 years post-randomization. A myriad of secondary outcomes were included. 453 patients were recruited. The mean age of the participants was 67 years in the trabeculectomy arm and 68 years in the medical management arm. The mean difference in the Visual Function Questionnaire 25 score was 1.06. There was no evidence of a difference between arms in the EQ5D5L score, the Health Utilities Index, and the Glaucoma Utility Index. The mean intraocular pressure was 12.4 mg of mercury in the trabeculectomy arm and 15.07 mg of mercury in the medical management arm. Fewer types of glaucoma eye drops were required in the trabeculectomy arm. Logmar visual acuity was slightly better in the medical management arm. There was no evidence of a difference in safety between the two arms. In summary, there was no difference between treatment arms in health-related quality of life as measured with the Visual Function Questionnaire 25 at 24 months. Intraocular pressure was better controlled by the trabeculectomy arm, and this may reduce visual field progression. Modelling suggests surgery may be cost-effective over a range of values of society's willingness to pay for a quality-adjusted life year. Have we missed any studies? Or would you be interested in authoring the next edition of This Month in Optometry Science? Let us know in the comments below.